Welcome to The Explainer. Today, we are digging into an injury that you just can't see on an x-ray, post-traumatic stress disorder. We're going to walk through the big ideas from Dr. Atef Ahmed's incredible book, From the Trauma Bay to the Mind, which is really a guide for everyone, the doctors treating trauma and the people living through it. So let's start with this quote from the book. It hits you, right? It perfectly captures this idea that when the medical emergency is over, a whole new journey is just beginning. The physical wounds might be closing, but the mental one, that's a different story. And this image, wow, it just captures the book's mission perfectly, doesn't it? You see that very clinical, very physical setting on the left, but the real story, the one we're going to explore today, is that invisible path from the trauma bay into the incredibly complex world of the mind. All right, so let's dive right in. Our first section is all about that invisible wound. So what is PTSD really? Let's break it down. The book makes a really important point here. It's not just about the scary thing that happened. Trauma is when that experience is so completely overwhelming that it basically short-circuits our brain's ability to cope. It leaves behind this lasting imprint of fear and total helplessness. Dr. Ahmed uses this absolutely brilliant analogy. Think about a fire alarm, right? With normal stress, the alarm goes off when there's a fire, and then it stops when the fire is out. Simple. But PTSD, that's the alarm still screaming, still blaring, long after the fire has been put out. The brain's threat detection system is literally stuck in the on position. And that right there is the fundamental difference. Normal stress, it's like a bad storm. It's intense, but it passes. Your body and mind start to heal. With PTSD, though, the brain stays stuck in that alarm mode. It's persistent. And that's really what defines the disorder. Okay, so if the brain's alarm system is busted, what does that actually look and feel like in someone's day-to-day life? Well, that brings us to our next section, where we're going to talk about the symptoms you can't always see on the surface. So, all these confusing, overwhelming feelings, they can actually be grouped into four main buckets. First, there's intrusion. That's when the trauma just bulldozes its way into your present, with nightmares or flashbacks. Then there's avoidance, where you start shrinking your own world just to stay away from anything that reminds you of what happened. Third, you've got those negative thoughts and moods, things like guilt and shame that just poison how you see yourself and everything around you. And finally, there's hyperarousal, that constant feeling of being on edge, jumpy, always waiting for the other shoe to drop. Now, knowing what the symptoms are is a huge first step, but giving them a name, getting an actual diagnosis, that is the key that unlocks the door to actually getting better. A formal diagnosis is just so incredibly powerful because it acts like a roadmap. It takes this chaotic, confusing internal storm and it validates it. It says, what you're feeling is real. It has a name. It tells you you are not broken, you're not weak, and you are definitely not alone. It proves there's a path forward. And getting that diagnosis helps us just smash these harmful myths that stop people from getting help. Let's be really clear. PTSD is not just for soldiers. It's not a sign of weakness. It's a biological injury to the brain. And the idea that talking about it makes it worse? Absolutely not. Guided professional talking is one of the very best ways to heal. This brings us to what is, for me, the most vital part of this whole story, the road to recovery. Because no matter how dark it gets, the central message in Dr. Ahmed's book is one of powerful, undeniable hope. Okay, now I want you to really lean in for this next part. This is setting up what is, without a doubt, the single most critical message in the entire book. Seriously, if you remember only one thing from our time together today, make it this. That's it. It is that simple, and it is that profound. PTSD is treatable. Real, life-changing improvement isn't just a fantasy. It's what's expected with the right kind of care. Nobody has to be stuck with that alarm blaring forever. And recovery isn't just one single thing. It's a whole person process. The book really hammers home that this isn't just about taking a pill. It's about a whole toolkit. Everything from specific, targeted therapies and peer support groups to mindfulness and, yes, sometimes medication to help turn down the volume so the other therapies can work their magic. The guide also gives this wonderfully clear, compassionate advice for the people who are right there in the trenches with the person suffering, the family and friends. And the message is simple. Listen without trying to fix it. Encourage help without pressuring them. And, this is so important, take care of yourself too. And that leaves us with one last really powerful thought to chew on. The book touches on this idea of post-traumatic growth. It challenges us to think beyond just getting back to normal. I mean, what if this journey, as hard as it is, could actually uncover a kind of resilience and strength you never, ever knew you had? And that brings us to the end of our explainer, all based on Dr. Atef Ahmed's incredible book. The goal is so simple but so important: to offer a practical, hopeful roadmap for every single person touched by trauma, doctors, patients, and their families. Because understanding this journey is always the first step toward healing it.